Hi, this is Dr. Michael Chez from Sutter Neuroscience. I want to update everybody on the hot topics in autism for 2013. It has been a very exciting year for news in autism. I think our number one story to discuss is the rate of autism just released by the Center for Disease Control in the last month. It appears that autism is now occurring in approximately 1 in 50 total children in the United States, which is up from a previous 1 in 88 children. These numbers have gone up every few years when the CDC does a compilation, and these represent numbers that are probably about 2 years old, so around 2010 to 12 numbers versus current numbers. The facts are that boys are probably going to be somewhere between 1 in 30 and 1 in 40 new births. This is quite new information and really reveals that despite all the arguments that say autism isn't increasing versus autism is increasing, I think pretty much most mainstream scientists now agree autism is increasing. It's not just that we're better at diagnosing it. Now, everybody with autism in that diagnostic category doesn't mean severe autism. There's a whole spectrum of autism disease. And I think it's important to remember that some of these cases are very mild and some are more severe. This is something that we've looked at Sutter, and we found that we have approximately 1 in 57 children in our system with autism, and we find genetic causes or links in approximately 32% of those, which is better than national average of finding genetic problems, which suggests that we're doing very good state-of-the-art screening here. The other thing that's exciting is we do a lot of epilepsy and EEG work, and our population is probably having about a 50% rate of abnormal EEG findings, some of which are treatable and can make a difference in the child's quality of life. So what I want to update people on in terms of the number one story is, yes, autism is increasing. We don't have an exact answer. 2, these numbers are probably realistic, and our local numbers reflect the national numbers pretty accurately. So I think that we are seeing what the national average reflects. And I also think it's something that we'll have better answers to now that we're having better genetic findings of testing that's now available, allowing us to get an even higher rate compared to the previous rate of about 15 to 18% having abnormal genetic links with autism. Now we're able, with better testing and technology, to find approximately 30%. So I think as our skills and knowledge gets better, new treatments will come about. As far as the next thing I'd like to talk about with autism, and I think the next big topic, is the DSM-5 is going to be released soon. The DSM-5 is the Diagnostic and Statistical Manual put out by the American Psychological and Psychiatric Association. What's important about this is the same manual that gives us the main criteria for diagnosing autism and what used to be called pervasive developmental disorder not otherwise specified, or PDD-NOS, as well as Rett syndrome and other classifications put on the prior pervasive developmental delay category. There's been a lot of debate about whether autism will be harder to diagnose and it'll be more strict, and some of the milder cases, such as Asperger's, will be eliminated from autism. I don't think most of us in practice agree with that, nor do I believe the regional centers are going to cut services based on mild versus severe, other than for economic reasons where some of those services have been modified. I will say that I believe that the current rate of 1 in 50 will continue to reflect a high rate of autism diagnosis, and therefore I don't believe using the criteria we use now, which is the ADOS, which is the Autism Observation Diagnostic Survey, and also the ADI, Autism Diagnostic Interview, which are gold standards, will still pick up the cases of autism that we're picking up today. And I think it'll really be in some ways easier to put everybody with milder cases in the category of autism, because Asperger's and PDD-NOS will soon be just part of the autism diagnosis, and hopefully more people will actually get services versus less. I think that's very exciting. The other great excitement is that the current presidential administration has announced $100 million worth of research to be released in 2014 for brain diseases, including autism. And I think that's very exciting, as this is another major surge to try and help neurodevelopmental as well as aging disorders like Parkinson's and Alzheimer's. I think that autism awareness and autism treatments and research will increase based on this and will allow us to move forward. The last thing I want to talk about today is we've been involved excitedly in a research study involving stem cells coming from umbilical cord blood. People who have their own umbilical cord blood saved have been part of a research study which is currently approximately halfway enrolled and should be fully enrolled by the summer of 2013. We expect some preliminary results hopefully towards the beginning of 2014, and hopefully we'll be able to get a trend of whether some of these patients are responding or not. At this point, it's a placebo double-blind study, but the fact that we're involved in a actual clinical study using stem cells in autism is very exciting, and we look forward to more studies in the near future. I think that stem cell research in autism is just in its infancy, and I want to let you know that much of this work being done is going to just skyrocket in the next 5 years with specialized cells and treatments. So if you weren't part of our study, it's very exciting to know that whatever our results are, it will hopefully lead to newer and better ideas and better studies in the future that you can participate in if there is value to this therapy. The reason we're taking our time with this is to do it right so that we don't mislead people with false hope in case the therapy isn't successful, and then we can troubleshoot whether it's just not a good therapy or whether it just didn't work for reasons that have nothing to do with its effectiveness, but more of the way the study was designed. At that, I would say that there's many new treatments out for autism. Many medicines are undergoing FDA approval for things that may improve socialization. Our baclofen is in trials for this. Old-fashioned regular baclofen is still useful for some children and may be a consideration if you're not able to be in those trials. Memantine or Namenda, an Alzheimer's drug, is also being studied for FDA consideration. Those trials are still underway. And I hope that we'll have at least some announcements in the next 2 years for new drugs for autism that are available to help children with certain subsets of autism spectrum symptoms. And there may be a trial nationally looking at treating epilepsy in a subclinical fashion if there's abnormal EEG in autism. There will be a consortium of the Autism Treatment Network finally doing a study we've asked for years based on research I've done and others have done that will hopefully lead to epilepsy treatment or not treatment being answered for people who don't always know that children with autism should get an EEG as part of their evaluation. I hope that people will continue to learn about autism, look at our Facebook page for updates, and continue to check our website and other websites around the country from sources such as Autism Speaks and the National Institutes of Health or the CDC so that you'll be able to get accurate information about autism. And we look forward to working with you and our autism patients going forward in the future. Thanks for listening.